A quick review: the pharmacology of the antihypertensive agents. Calcium channel blockers. They are blocking the entry of the calcium from entering the arterial vascular smooth muscle. Here we have arterial vascular smooth muscle. We're enlarging the smooth muscle here, vascular smooth muscle. So normally we have a calcium channel. The calcium will be in. Now that will be increasing the interaction between the actin and myosin and will be produce a contraction. If we block these calcium channels by the calcium channel blockers, then we are preventing the entry of calcium and producing a relaxation in the smooth muscle. So by that it will be producing vasodilatation because we are increasing now the diameter of these small arteries, which responsible about the peripheral vascular resistance. So that will be leading to a decrease in the peripheral vascular resistance. Here we have a different drugs. They ending with dipine, nifedipine, nicardipine. Nicardipine is giving an IV in the emergency situation. Amlodipine and felodipine. Those who are ending with dipine, they are more specific for the smooth muscle in the small arteries, vascular smooth muscle. We have another drug, diltiazem. Now this drug is working both in the smooth muscle of the arteries and also in the heart. And verapamil, this one is more specific for the calcium channels in the heart. So it will be working through the SA node and AV node. So these two medications, by blocking the calcium channels in the heart, they are going to decrease the cardiac activity. And that will be leading to a decreasing in the stroke volume and in the heart rate, which will be ending with a decreasing in the cardiac output. So now, if we are decreasing the peripheral vascular resistance and the cardiac output, that is going to decrease the arterial blood pressure. Calcium channel blockers producing some side effects like dizziness. It can be understood by decreasing the blood pressure. Constipation, because they are producing relaxation in the smooth muscle of the GI tract. The swelling in the feet and legs, because again they are producing relaxation in the smooth muscle of the blood vessel. So the fluid will be accumulate and then it will be leaking out of the blood vessel to the tissue and producing a swelling effect. Increase appetite. The GERD, because again they are producing a relaxation in the smooth muscle of the sphincters, so it will not be able to maintain the enough pressure to prevent the return back of the acid to the esophagus. Tenderness or bleeding of the gums, very similar to gingival hyperplasia. And finally, we have a sexual dysfunction, mainly in males. So we have seen that the stimulation of the beta-1 receptors in the kidney is going to release the renin, and renin is going to activate the system, renin, angiotensin, aldosterone system, beside releasing the antidiuretic hormone. And that will be leading to an increase in peripheral vascular resistance. Now, the antidiuretic hormone and aldosterone, beside that, the stimulation of the beta-1 receptors in the heart is going to increase the increase the stroke volume and increase also the heart rate. So both of them, increase in stroke volume and increase in heart rate, is going to increase the cardiac output. Now, both of them, increasing cardiac output and peripheral vascular resistance, will be leading to an increase in arterial blood pressure and hypertension. So now it will be very logical if we are going to use a medication that will be block the beta-1 receptors specifically. So by blocking these receptors in the kidney, we are preventing the release of renin, and then we are depressing the activity of that system, renin, angiotensin, aldosterone system, and the release of antidiuretic hormone. And also so that will be leading to a decrease in peripheral vascular resistance. And also by blocking the beta-1 receptors in the heart, so we are going now to block the increase in stroke volume and increase in heart rate. We are going to block that, so we are going to lead to a decrease in cardiac output. So now the decreasing in the peripheral vascular resistance and decreasing in the cardiac output is going to decrease the blood pressure and is going now to treat the hypertension. Now, some of the beta-1 selective blockers, as you can see, their name starting from A to M. I arrange them alphabetically: atenolol, betaxolol, and so on. So all of them will be starting from, all their names will be starting from A to M, except for nebivolol, because nebivolol have additional activity beside blocking the beta-1 receptor selectively, is going to increase the release of nitric oxide from the endothelial tissue, and that nitric oxide will be diffused in the smooth muscle of the blood vessels and will be produce more relaxation. Now you can see all these beta-1 selective blockers, their name will be ending with olol, except these two medication, carvedilol and labetalol. Their name ending with lol only, which means that, just like to differentiate them, they have an additional blockade activity. Besides the beta-1 receptors, they are going to block the alpha receptors. And labetalol is giving IV. And finally, we have the ismolol. Ismolol also is supposed to be given an IV, have a very short duration of action because it will be hydrolyzed by esterase in the red blood cells, and it's usually given to control the hypertension during the operation or after the operation. Now, these beta-1 receptor blocker, they are going to reduce the mortality after myocardial infarction, because in myocardial infarction, the most reason for death after it is dysrhythmia. And that's because we have an activation of the sympathetic nervous system as a compensatory mechanism. So this agent is going now to block the beta-1 receptors and block the overstimulation of the beta-1 receptors. The same in patient who has heart failure, because again we have an overstimulation of the sympathetic nervous system as a compensatory mechanism. Again, that is going now to stimulate the heart, which it is already the heart is having a problem. So again, this agent is going to block the beta 1 receptor, so they are going to prevent the increase in the heart rate and prevent the increase in the contractility and so on. Now, these medication, they should not be stopped suddenly, because of whenever you are using a blocker for any receptor, you are going to produce a sensitization or upregulation of the receptor. So if you stop the medication suddenly, now you are exposing the tissue to an overstimulation with the normal neurotransmitter and the natural one, because you have an increase in the number of the receptors. Now, the side effects of this beta 1 receptor blocker, bradycardia, fatigue, and cold hands, it can be understood by the blocking the beta 1 receptors in the heart and decreasing the blood supply to the tissue. The vivid dreams, which it is very strong dreams that it can be remembered directly, that because it is that's this medication will be affecting the function and the release of some neurotransmitter in the brain. And finally, just will mention about that they are going to mask the hypoglycemic awareness, which means if you have a diabetic patient and he is receiving some medication to treat the high blood glucose, so one of the major side effects for this anti-diabetic medication, specifically for insulin, is to produce hypoglycemic effect, to lower the blood levels of glucose. And the patient will be able to be aware about this symptoms or this incidence by having a tachycardia. So now this agent is going to block the tachycardia, so he will not be able to receive and he will not be able to know that he is having a decrease in the blood glucose level. The vasodilators, we have two medication. Now these vasodilators, they are only dilate the small arteries, not the veins. We're starting with the hydralazine. Hydralazine have three mechanisms to produce relaxation in the small arteries. The first one is to open potassium channels, so potassium will be leaking out because it is a positively charged, so we have hyperpolarization inside the vascular smooth muscle. The second mechanism, we know that IB3 will be inducing the release of calcium from the sarcoplasmic reticulum, and then the calcium will be increasing the interaction between actin and myosin to produce contraction. Hydralazine will be inhibiting this type of mechanism. The third one, that hydralazine will be increasing the release of nitric oxide from the endothelial cells. Nitric oxide will be diffused in the vascular smooth muscles, and through the activation of a specific enzyme will be increase the production of second messenger cyclic GMP. Now all of that, the increase in cyclic GMP and the decrease in the calcium near the actin and myosin, and the hyperpolarization will be leading to a relaxation in the vascular smooth muscles. And that will be decreasing the peripheral vascular resistance. As a compensatory mechanism, we will have a reflex tachycardia. Now, the hydralazine will be metabolized in part by acetylation. So we have some people, they have a fast acetylation for it, and some of them, they have a slow acetylation for it. And that will be affecting some of the side effects or toxicity for this medication. The adverse effects, it can be predicted because we are producing some kind of vasodilatation, so it might be leading to a headache, nausea, anorexia. And also because we are producing reflex tachycardia, the patient might be having a feeling of palpitations. Again, because we are vasodilate the small arteries, so the patient will have an increased sweating and flushing. However, we have some unique toxicity for the hydralazine. It is the lupus-like syndrome. The second drug in this group, the vasodilators, is a minoxidil. Minoxidil is very effective orally, is working by the mechanism by the potassium channel, to open the potassium channel. So the potassium will be out, and then that will be leading to hyperpolarization and relaxation in the vascular smooth muscle. And that will be decreasing the peripheral vascular resistance, which will have a compensatory mechanism as a reflex tachycardia. Minoxidil is supposed to replace hydralazine whenever we have an ineffect for hydralazine, if we have a severe hypertension or if we have a renal failure. Because of the side effects for minoxidil is very strong, so minoxidil should not be used alone. It always should be combining with a beta blocker and a loop diuretic to manage the tachycardia and to manage the edema. Minoxidil will produce a headache and sweating, as we have seen with the hydralazine, but we have a unique side effects for minoxidil, hypertrichosis, which means that we have an overgrowth of the hair in an acceptable area in the body.